And we're back!
Yes! Good morning, Ulat Tita
Good morning.
Angel.
Pero bago ang lahat, gusto ko muna batiin ang aking Mother Earth who's watching right now, all the way from Manila, of course.
Si
And
Mama,
Ellie Eunice Domingo, happy 6th birthday. Ganun rin. At saka si Tita
it has a lot of,
Flory sa
fat,
New Jersey,
so
sa
it
Tito
will be
Rico. Si Tita
very
Flory, happy birthday.
very
Tsaka binabati ko rin si Mama, nanonood ngayon, tsaka yung ating mga viewers sa ating Facebook Live.
Very
Yan ang father
caramelized.
ko at saka ang father ko.
And because of
Kasi
this
medyo
specific
medyo
pork,
at
the Iberico
si
pork
Ron,
from
si Joshua, good
Spain,
morning sa inyo. At si
it has a lot of marble
good
inside.
morning.
Oo, pero ngayon, Tita Angel and Rina,
Tama.
kasama natin ngayon si Dr. Oliver Estrada na isang
Spain.
internal internist dito sa ospital na colorectal Hospital dito sa Singapore.
Good morning.
Good morning,
Good morning
Doc.
po sa inyo lahat.
It's nice to meet you po.
Thank you rin po.
Ating kababayan dito sa Singapore. And this time around, we're going to talk about colorectal cancer. Before we go
Colorectal
through
cancer.
yung symptoms and treatment, we would like to know, ano po ba talaga itong colorectal cancer?
Okay, ang colorectal cancer is basically a malignant outgrowth po na, or mass, shall we say, mass along the large intestines. So the large intestine is composed of the sigmoid colon, the ascending colon, transverse, descending, and then yung sigmoid and rectal region. So any outgrowth of a malignant nature doon along the line is actually a
Kaya natin tinawag na
cancer.
colorectal yan
Yes.
kasi
Colon
colon
and
rectal
rectal.
together.
Connect kasi sila,
Opo,
diba?
tama po.
So, in yung statistics naman natin dito, ilan po ba yung namamatay dito? It's the most common cancer po ba? na
No.
matuturing natin?
Actually, according to the statistics, what we have here in our
Parang
system
how
right
many
now
people are
is
affected by it?
yes, colorectal cancer is the fourth most common cause of cancer in the U.S.
Talaga?
Yes, and then according to the statistics, yung namamatay dito sa colorectal cancer is second most common.
Pero Dok, paano mo naman malalaman kung meron kang signs and symptoms na meron kang colorectal cancer?
Okay, doon tayo papasok sa mga symptoms noon. The most common symptom na nakikita natin kapag meron tayong colorectal cancer, nasa screen natin, magkakaroon tayo ng rectal bleeding. Yan.
So ano to, every time you
Rectal
poo,
bleeding.
there's
Every time you poo,
blood.
you will be able to see blood, as in
Okay.
gross blood. Yes.
Wait lang I want to differentiate it. Kasi di ba may mga tao may hemorrhoids na kapag meron silang lumalabas yung hemorrhoids na, nagbe-bleed din yun. So how
Correct.
can you differentiate it from the colorectal cancer, yung bleeding niya?
Correct. Doon na tayo papasok sa mga workup noon. So everything na merong bleeding na nakikita natin sa passageway when we pass motion, kailangan ka agad ng evaluation ng through endoscopy
Kasi
or
di ba
colonoscopy.
ginagawa nyo kung tinitingnan nyo yung blood dyan kung fresh blood ba siya, kung dark blood ba siya, di ba doon yung
Correct.
malalaman kung
Yes.
gaano kalalim yung
Yes.
yung ano niya, tumor niya or something,
Yes,
di ba?
yes.
Parang ganun.
So going back dun sa symptoms, what else?
So, bleeding, weight loss, pagkatapos abdominal pain.
Abdominal pain?
Yes, because as
Connected yan.
yes, as the tumor becomes bigger and bigger, the tendency of it to obstruct the passageway is very high. So, of course, everything that we eat, di ba, automatic dapat ilalabas din natin siya
Yes.
at the other end of our gastrointestinal tract. So, if there's any obstruction anywhere in the pathway, magkakaroon ng distension, hindi siya makaka-flow, and then eventually, pag talagang malaking-malaki na siya, magdi-distend siya up to the point na pwede siyang mag-rupture. So, it's a disaster. kapag
Pwede siya
ganun
maging
nangyari.
colorectal cancer.
Pero syempre, Rina, we would like to know also kung ano yung mga contributing factors. Bakit kami
Hereditary
nagkakaroon,
ba ito?
di ba? Is it in
Yes.
the genes or
Actually,
the lifestyle?
Yan, magandang mga questions yan. Kasi, merong, actually, before I say that, merong, ang most common cause actually ng colorectal cancer is actually what we call sporadic siya, which means it happens randomly. There's no way we
Really?
can tell. Yeah, it may happen to any one of us. So that's why screening comes very, very
Walang age
important.
na pinipili ito, Dok.
But,
Tsaka,
gender.
Oo.
Gender.
May pinipili ba ito?
Meron. Actually, this colorectal cancer can happen sa males and females, but according to the statistics, it is more common to males.
Bakit sa males?
That one, actually, it's not really very
Baka
clear.
lifestyle. Hindi ba? Lifestyle nila.
And then, it also occurs in females, but not really very minimal. It is slightly with the preponderance dun sa mga lalaki.
Kaya pala parang ngayon ko lang ito narinig. Hindi pala kasi common sa babae.
Pero ang tanong dyan, is it treatable or manageable lang?
The thing is, ang problema dito ay it will depend on the stage of the disease.
Or stages?
Siyempre, kapag localized pa lang siya, meaning yung pinaka-tumor ay maliit pa lang at nandoon pa lang talaga siya dun sa pinaka-lining, hindi pa siya nag-i-invade because when we say cancer or malignancy, there is always a tendency to invade the deeper structures and to metastasize or to spread to
Speaking of yung maliit
far.
pa lang siya, na tumor siya, nakakaramdam ka na ba ng symptoms at that stage? Hindi pa.
Hindi pa,
So
actually.
hindi mo malalaman unless magpa-test ka.
Correct. The thing is, the reason why some of the or most of the colorectal cancers are diagnosed quite late in the disease process because during the early stages, wala talaga siyang symptoms. Yeah.
But how often do you have your colon checked? Para in
At
that
what
way, di ba parang namomonitor mo din?
Correct. Ideally, kapag meron tayong mga risk factors like yung hindi pa natin nababanggit, yung tinatawag na familial adenomatosis, yes, FAP in short.
FAP.
Yes, FAP in short. Meron tayong high chance talaga ng pagkakaroon ng colorectal cancer. Yes. For example, ang isa sa mga magulang natin ay merong FAP. Very high chance na kung sakaling yung gene na ma-inherit ng anak natin, pwede niya talagang makuha yan with a very, very high chance. Yeah. So, kapag meron tayong lahi nun, kailangan i-mark na natin kaagad yun, which means yung mga anak natin, kailangan mas early silang magkaroon ng screening para ma-catch kaagad at an early stage.
No,
Yeah.
I'm just curious, no? Kasi usong-uso na rin ngayon yung mga katulad ng master cleanse, di ba?
Mga colon
Nag-detoxify
cleanse.
yung body natin, colon cleanse. Nakakatulong ba yan para makaiwas din tayo dito sa
Colorectal
Actually,
cancer.
magandang question kasi according to the lumalabas na studies ngayon, talagang nakakatulong ng maigi yung pagkain ng mga masustastansyang pagkain. Most especially yung mga green leafy vegetables, yes, fruits, correct, and then what they call this, yung mga legumes and beans. Fruits especially, they are rich in antioxidants.
Kasi high in fiber din. di ba?
And high in fiber.
Dapat marami
also.
pala kaming kainin na gano'n.
Para
Correct.
maganda yung flow. Oo. Pero ano yung mga klaseng tests that you guys normally do to be able to detect that a certain patient has a colorectal cancer?
Okay, actually, to diagnose colorectal cancer, there must be what we call histologic diagnosis. When we say histologic diagnosis, kailangan gawin natin yung tinatawag na colonoscopy. It is some kind of a device which is fitted with a
Naipapasok,
camera.
ano,
Yeah.
oo.
Meron pwede siyang lumabas na instrument sa dulo nun to be
Tapos?
able to excise or do what we call the polypectomy. Yeah.
May tatanggalin na.
Kapag nakita na nila, yung na-localize na nila yung pinaka-lesion kung saan sa part ng large intestines, pwede nilang i-access yun and they can actually do a biopsy. And this specimen can be sent to the laboratory for testing. And if we see and makita talaga under the microscope na mayroong malignant lesion siya, then some other, yes, actually staging muna and then, yes, may mga staging muna tayong ginagawa para malaman kung anong klaseng treatment ang gagawin natin.
And that's when you do yung cancer screening na?
Actually, yung cancer screening, even before ma-detect talaga natin na may cancer, yung mga wala pang nararamdaman, we advise them to have,
Right away.
at the age of 50, there is some recommendation already to have a regular
Actually, kasama po yan sa executive.
50 years. 50 years old.
Check-up kasama po yan di ba?
Ideally, oo.
Ano naman po yung pwede niyong ma-advise dun sa ating mga viewers para ma-prevent nila yung ganitong klase ng cancer?
Actually, meron tayong mga tawag dito, mga dapat iwasan. Especially, actually, nakita nga natin sa studies na ang mga may overweight at saka
Naku!
obese, may high preponderance to have colorectal cancer.
What about,
High risk sila.
High risk. Plus, yung mga walang exercise, yung weight.
Yung mga sedentary,
lifestyle. Sedentary lifestyle.
sedentary lifestyle, naku.
Yeah.
Sila nga magbagong buhay na talaga.
Mataas ang risk nila.
Pero Doc, in terms of food, ano ba yung mga dapat iwasan namin para hindi kami maggantong
Okay, napakagandang
colorectal cancer?
According to studies, kailangan nating iwasan ang kumain ng mga red meat,
Red meat.
processed meats, or like hot dogs, sausages, and
Mga chicken nuggets.
Mga luncheon meat.
luncheon
Kung ano
meat,
pa yung masarap
anything na nakalagay sa...
Anything na
Yeah,
processed.
canned,
Pati yung
processed.
mga yung mga instant noodles, iwasan na din ba namin?
Pero wala akong, to be honest, wala akong nabasa na ang noodles ay associated to sa colorectal
Mostly
cancer.
mga meat.
Meat, red meat.
Talaga.
Yes.
Sabi mga nasa can kasi may, malakas yung ano nila, preservatives doon.
The preservative
which
contents talaga
damages the...
maaari.
Would it help, Doc, na lahat ng kakainin ko organic?
Yes, definitely.
Definitely,
Yeah.
100%. Oo.
Mare-revert pa ba yung ano no, yung effect na for example, for the last 30 years, puro processed food yung kinakain mo. Tapos after nun, medyo na-realize mo,
Nag-lifestyle change
you want
ka
a healthy
na.
lifestyle na mare-revert pa ba yun?
Medyo mukhang magiging irreversible na siya. Kasi once cancer has set in, it's an irreversible process na. Talagang mag-i-invade na siya deep to the tissues. Pwede pa siya mag-spread sa lymph nodes and to the distant organs like the most common is sa liver, sa lungs, at saka dito sa ating peritoneum or dito sa abdominal cavity. Pwede siya talagang kumalat.
So in a nutshell, what we can do to prevent nga, di ba, is to go to your doctor, see your doctor regularly.
Correct.
And live a
Wag-
healthy lifestyle.
Exactly. At
Exactly.
wag iintayin na may nararamdaman tsaka lang pupunta si doctor.
Before
Exactly.
it's too late.
Yeah.
Doc Oliver, saan po ba kayong hospital dito sa Singapore?
Nag-work ako sa Kutekwat Hospital along Yishun area. Yes.
I like how you said it. Kutepwa.
Uy, sa mga ano natin, kababayan nating Filipinos,
Oo.
dito pwede sila magpa-check, diba? Kaya
Kay
Dr. Oliver Estrada.
Your contact number dito para dun sa ating mga
Oh.
kababayan, diba? Pwede naman, diba? Para
Yung inyong clinic.
clinic na lang.
Actually, hindi ako kasi naka-assign sa clinics. More on sa mga naka-admit na patients.
Okay. Ayos
Resident
pala
doctor
yun.
to see doctor. Alright. Thank you very much, Doc Oliver Estrada.
Thank you, Doc.
Pleasure meeting you.
It's my pleasure to be here as
And
well.
thank you also for enlightening us about colorectal
Colorectal cancer.
You're
And we
welcome.
hope to see you again.
Parang gusto ko magpa-
La la